Now, today's agenda is how do we find natural remedies for painful chronic ailments? Specifically, we'll talk about ankylosing spondylitis, arthritis, rheumatoid arthritis, osteoarthritis, fibromyalgia, multiple sclerosis, gout, and many undiagnosed joint pains that we have. We lead our, it's our body is like an onion. Okay, so there are layers and layers on layers of pains that we have, and we just stay with them, or we take it for granted, and we live our life in pain. Most of us, we tend to go to doctors and don't get the right answers. So we'll touch base on that also. So let's start. Now, what's the challenge today? The challenge is that these diseases do not have a medical cure. That is the biggest challenge that we have. Okay. The medicines that you get from doctors are mostly to manage the symptoms of the disease. Okay, you do not get a complete cure of these diseases, all the diseases that I mentioned. So young adults now, what is happening is even young adults are getting depressed and getting attacked by these debilitating chronic pain diseases. So it ranges from mild, severe to debilitating. It's hard to diagnose. There are multiple tests that people do, but all are broad range tests. We don't get a conclusive answer from the doctors. There's very low awareness among patients and very low support from family and society. Okay, our families just think that it's just a back pain, or it's all in your head. You're not doing the right things, or you're not exercising, or you have probably overstrained yourself. These are some of the answers that we get of our families, but they're not very supportive about it, or they don't know how to go about helping a person who is going through pain. So there is a lot of lack of knowledge also among the medical community as well as among physiotherapists. So the bottom line is that we don't have a holistic advice when it comes to managing chronic pain. Okay. So what do we do? So this is the approach that I came up with, and which is the base of our coaching. So we believe in completely holistic approach. So the approach consists of Egoscue. Egoscue is a pain therapy. Okay, we'll deep dive into that. It also constitutes looking at food as medicine. So moving towards non-inflammatory diet, looking at vitamins and supplementation so that our body is optimal in all vitamins and minerals. Mindset, how do we overcome depression and sadness? Okay. And of course, meditation so that we can energize ourselves. The approach that I take is constituting of all this. We'll look into each of these one by one. So let's start with Egoscue. What is Egoscue? So it's a pain management therapy. It is used for basically reducing the loading in your joints. So we have 8 joints which are stacked one over other. So these are your shoulders, your hips, your knees, and ankles. They are completely stacked over each other, and due to gravity, whenever there's a dysfunction in any one of these joints, you tend to develop pains. Okay, and probably a dysfunction in your hip would affect a dysfunction in your shoulder. So so if you look at the spine here, okay, so the entire thing is like a chain, right? So you have the neck, and you have the thoracic spine, you have the lumbar spine, and then you have the hips, and then you have the knees. Now, if anything goes wrong in your hips or in your pelvis joint, there would be a repercussion in your cervical. Or if anything goes wrong in your cervical, there would be a repercussion in your hip joint. So because everything is connected, okay, our body is not disjoint from each other. We are completely in a chain. Okay, so we are completely in a chain. So this chain has to be understood. We sometimes, go to doctors and talk only about hip pain or only about neck pain. That doesn't work. Okay, that's not the right approach, because even if you treat the hip pain, you are just treating the symptom. The root cause could be something else. Okay, so again, I'll go back to my screen share. Yeah. So that's why what Egoscue does is we reduce the loading in each of these joints. We bring them into alignment. If you see the picture on the right here, we bring all these joints into alignment, and that in itself reduces the pain. So what kind of pains can be reduced? Everything from back pain, shoulder pain, elbow, hip pain, migraines, knee pain, plantar fasciitis, and even ankle and jaw pain. Now, I would want to do a small experiment. Let's experience this right now in this call. Are you all with me?
Yes.
Yeah.
Okay. So wherever you are, wherever you are sitting, or I just want you to get up and stand. Okay. Wherever you are, just stand up.
Yeah.
And just try to see when you are standing, where, just close your eyes and feel where is your weight going. Okay. Do you have any pains or aches today in your body? Maybe it's in your knee, it's in your ankle, a slight pain in your hips, or somewhere in your shoulder, or somewhere in your neck. Okay. Understand that. So wherever it is, okay, just try to analyze your body for like 5 seconds and see that. Now, what I want you to do is I want you to keep your feet like this. So most of us have our feet, stretched out, pointing outwards. I just want you to just bring your feet inwards. Okay, just bring your feet inward. So we call this as pigeon toe feet. Okay, so just bring your foot inward, both the foot inward. You will have a pressure in your thumb and in your inner thighs. Okay, and just stand like this while I'm speaking. I will also be standing like this. And while I'm speaking and I'm showing the slides, just stand like this for 3 minutes while the slide is being shown. Okay, I will again go back and start sharing. Please do not change your stance. Okay, just stand like that for 3 minutes. So Egoscue is founded by Pete Egoscue from USA. It's instituted in San Diego, USA. Here we treat the body as a unit. So as you are standing right now, you are treating your entire body as a unit, and we'll see what happens right after 3 minutes. Okay, so the effectively, this reduces the pain in 90% of your joints, and 90% of pain is addressed by Egoscue. One of the exercises is what we are doing right now. It's a 3-point toe raise that we are doing right now. And it's highly, highly effective for arthritis, AS, ankle-losing spondylitis, RA, fibromyalgia, and many, many undiagnosed pains. It reduces inflammation too, thereby. Okay, we have around more than 300 exercises, and they are delivered online to your homes, just like this, the way I'm doing it right now. It's delivered online. Okay, now why Egoscue? Why should we do Egoscue, and what is the reason why it is so effective? So here we should understand that when a person is in pain, okay, they would want to start from the most comfortable position. For example, if you are able to stand right now, that's your most comfortable position. Or if you're able to sit, that's your most comfortable position. Or if you're able to sleep, some people are bedridden and they would want to sleep, and that's their most comfortable position. Okay, so we start from what is the most comfortable position for the person. All these exercises are very, very doable exercises. Okay, and we start from a pain-free range of motion. The principle that we adopt is we mitigate the symptom. Okay, reduce the rotation in your joints. Our joints are twisted, rotated. Okay, we reduce that rotation. Neutralize the pelvis. Okay, and work from inside out rather than outside in. Okay, which is what traditionally done by medicines. And we leave the body in neutral then. And it works like magic. Okay, so the principle is more like straighten before we strengthen. So we need to straighten the body before we strengthen. All right, guys. So I now want you to, come back normal and just analyze yourself as to the pain that you had earlier or the discomfort that you had earlier. Did that go away, or did that reduce, or did that increase? Okay, so have that analysis in your head. So simple standing posture like these, okay, if you just stand like this every day, you bring in an alignment in your pelvis. Okay, so our pelvis is the main joint. It's a biggest joint in our body, I would say, the hip joint, and it rotates. And due to this rotation, your shoulders get affected, your neck get affected, and even your knees get affected. Okay, in worst cases, you will have one leg coming up a slight half an inch, or you will have a limp starting with, you will see that with old people a lot, that they develop a limp as they become old. Okay, the reason is that there is a pelvis issue going on, not the leg. Okay, so simple exercises need to be done every day, so that you get tuned, your body gets tuned, and it never loses its shape, and you maintain that posture, and that reduces the pain drastically. Okay, so going back to sharing again, Sunan, you may relax.
Yeah.
So so I'm sharing some of the exercises here. You can try it out at home. So sitting knee pillow squeezers, static back position. So when we deliver these exercises, we deliver through videos, and some of the videos look like this. So I'll just share the video here. These are very detailed videos which are provided. So for example, have a look at this.
Upper spinal floor twist. To begin this exercise, you're going to lie down on one side in the fetal position. As you can see, he's lying down on his right side. His feet and ankles are stacked. His knees are stacked. His pelvis is perpendicular to the floor. His knees are at hip height. They're not below, so there's a 90-degree angle at all of the lower body joints. The hands are placed on top of each other. To begin the exercise, you're going to take the bottom hand, which would be his right, and he'll put it on the top part of his left leg to hold his knees together. He will slowly open up the left hand to the open upper spinal floor twist position, and his head will go to the ground and look in that same direction. The right hand applies a downward pressure to keep the knees stacked above each other. And as you can see, his knees may have slid back a little bit, so now he's going to restack them. Slide your head to the left slightly and turn it to the left. In this position, his left hand should not be above his shoulder level. It should be right at the shoulder or slightly lower. You're going to breathe into your stomach and your back using your diaphragm, or what we call east-west breathing. And every time you breathe out, you will allow your upper body to open up into the upper spinal floor twist, keeping your knees and hips stacked.
So as you can see, it's a pretty detailed, it's a very, very detailed instruction which is given. And I normally do it online on videos also, help my customers and practice it together. So that's how these sessions are delivered. So Egoscue is highly effective for reducing pain.